Well, hello there. My name is Matthew Perry. I'm the CEO at the Genesis Healthcare System, and today I have with me Dr. Scott Wegner, our Chief Medical Officer. And together we wanted to share some news with you and information about kind of where we are in our community right now with COVID. So, as you probably know, we have a lot of the Delta virus in our community. And it has spread very quickly, and our current situation at the hospital is that we have about 75 COVID patients in the hospital, and it is putting a tremendous strain on our ability to be able to care for everybody who needs care in our community. You see that Dr. Wegner and I were wearing masks. We have this partition in between us. Everybody at Genesis has been, for the last year and a half, have been wearing masks. And I wanted to ask Dr. Wegner to maybe comment on that at some point, kind of the outcome of that. But maybe, Dr. Wegner, if you could start off with describing kind of where we're at with clinically at Genesis now.
I think first it's important to address that we are trying to be honest and transparent with what we say. So I've been a cancer physician for about 30 years, and 30 years ago I was making decisions for my patients with breast cancer, for example, and I was absolutely confident I was making the right decisions with the information available at that time. When I look back at those decisions from today's lens, I realize that many of the choices I made were wrong. And we're experiencing the same thing with COVID. We've had 18 months to learn everything that we know about this situation. Each day we've tried to make decisions for our patients and our community based on the information that we had available. And in some cases we've missed the mark. And when we look back, we wish we would have decided something different, but we didn't have the available information. I think sometimes that gets translated into, well, somehow we were lying about what we were saying, but I can assure you that we've tried to make the best decision daily with what we know. Today in our health system, as Matt mentioned, we have about 75 inpatients, 50 of whom are on ventilators. We've had many days in the past few weeks when we haven't been able to see everybody who's presented to our emergency department because there hasn't been a bed available or staff available. Additionally, as I speak, we have 60 employees who are positive for COVID and another 40 who are on quarantine, which is putting a big strain on our ability to care for folks. Last week, I was in a situation that I've never been in 33 years as a physician. We had 5 patients who needed emergency coronary bypass surgery and no beds to treat them. We actually had to sit and think which patient is most likely to die, and that patient will be first on our list. We tried to transfer patients to other hospitals in the region, but every hospital that we could refer a patient to had more than 100 people on a waiting list to be admitted. We were able to operate on the most sick patient almost right away. We transferred another one of the 5, and the other 3 are in the hospital safely waiting for their surgery. But I never thought in my whole career that I'd be in a situation where we had to think about rationing care for people that needed it today. And I'm fearful that if we don't do something different, we'll be in that situation daily here at Genesis.
Yeah, and so one of the things that it's just that we know that there's a lot of confusion out there. There's a lot of data and information that people are sharing, and one of the things that we wanted to share some facts that we know from our experience. As Dr. Wegner said, our knowledge of COVID has evolved tremendously over the last 18 months as the world has learned what works and what doesn't in the form of treatment and prevention. So one of the things that you're going to see a graph just comes up. I wanted to share with you, and I want to specifically talk about the children. We all know, and I think everybody in our community is agreement on one thing, is we want to have our kids in school. And kids have been harmed immensely over this last year and a half because they haven't had an in-person education. So what we wanted to share is what's happening in the school systems today. Our kids are back in school, but a lot of them are being put out on quarantine. So in the graph that's up in front of you here right now, you'll see these are all of the positive cases in Muskingum County. Now the counties around us look very similar to this, by month and by age group. And I'm going to really focus on, let's start over on the left-hand side in July. And I'm going to really focus just on the 0 to 19 age group. In July, we had 11 positive cases in our community of people who were 0 to 19 years old. In August, that jumped to 255. And then in the first 17 days of September, that went to 661. So that's not even a full month of September, because we're recording this on Tuesday, September 21st. So you can see that the spread in younger people, in school-age kids, has grown enormously. Why is that? There's really two main reasons. The first one is that the Delta variant is here, and it's extraordinarily transmissible. The second reason is that the majority of the school systems in our community are not requiring masks, and therefore it is just spreading. One of the things that we have learned from our own experience here at Genesis, Dr. Wegner, could you maybe, and I'll come back to the school systems in a second, could you describe a little bit about our experience at Genesis with the masks?
Sure. Since the pandemic started, we've required all employees and visitors to wear a mask in the hospital, and they've been this type of procedure mask. And in that time, we have had almost no cases of workplace transmitted COVID infection. Virtually all of the cases that we've had of employees positive have had an index case, or the person that infected them, outside of the hospital. I have, with the information I have today, absolute 100% confidence that masks reduce the risk of transmission. I think it's also fair to say that when you see the kids are infected, most people are of the belief that most kids aren't going to get very sick with this, that it's going to run its course and they'll develop natural immunity and everything will be fine. Unfortunately, and that may be true for the children, but the kids are bringing it home to people that are less healthy. And we have many cases in the hospital where the index case has been a child bringing it home from school. I'd like to read you a very poignant text message from one of my physician colleagues who was taking care of a patient on the floor. And this was last week. Today's COVID news from the floor. My 70-year-old unvaccinated patient is dying today of COVID. Her great niece brought it home from school. The patient's daughter is her primary caregiver and is also hospitalized on a different floor, also with COVID. The daughter gave me permission to see her in her room so I can have a face-to-face visit about her mother's rapidly declining situation. The daughter wants to make a goodbye visit, but she's clearly on a 100% face mask oxygen, and her oxygen saturations are dropping anytime she talks, cries, or rolls over in the bed. After sitting with her for a while and coordinating other ways she can say goodbye to her mom, I ask her if there's anything else I can do for her, and she says, "Can you tell me how my husband's doing? He's in the CCU on a ventilator." So it doesn't take too many experiences as a caregiver in these situations to know that we have to think about doing something differently than we're doing today.
Yeah, and so when you look at that graph and you see that the biggest point of infection right now in our community is our kids, and that was not the case in the first round of this, because the kids were at home. Because most of the schools were not operating during our peak times of COVID here. So what we're asking is, we had a meeting yesterday, 20th of September, with all the area superintendents, school superintendents, and we're asking for the schools to help us with even if it's not a long term. But starting out with, even if it's 30 days to start out with requiring masks in school. I know that is a very controversial topic. I want you to know that we have worn masks, as we've just discussed. We have worn masks at Genesis for 18 months. Do I like wearing masks? No, I really don't. But it's the only way that we have found that it works from preventing people to infect each other is only as if everybody's doing it. We know that the school systems have gotten an enormous amount of pushback on this. So what I wanted to share is an example. In our region, Morgan County, they put in a mask requirement, and they've only had it operating for 1 week. The week before, 2 weeks before they put it in, they had 400 students out on quarantine, and they had 33 active cases. With 1 week of masking in the schools, they went down to 92 students out on quarantine and 11 active cases. And I anticipate that's going to continue to go down. So it's been very proven that our biggest problem, the reason why that graph looks the way it does, is because of a couple of things. Number one, we've got the Delta variant here right with us now. Very, very transmissible. Number two is we have a low vaccination rate in our community. Only 48% of our adults are vaccinated in our community. And number three, the kids are in school without masks. And you put all those things together, and this is what you get. And what we are very concerned about is that the kids won't be in school. They're going to be home on quarantine, and our health system is going to be overrun and overtaxed to where we won't be able to take care of everybody. And there's nowhere to send patients. We are it. We're it for the whole region. Genesis is the clinical backstop for this whole region. And so what we're asking is, please help us. Please, if the school board in your district comes with a requirement or proposes a requirement for masks for a period of time to reduce this spread, please support that. We want your kids to get a really good education, and the only way to do that is for the vast majority of kids, if it's done in person. So we wanted to share this information with you. The community, you all have been so supportive of Genesis in so many different ways. I know that we're all tired of this, but I know we can get, it's a tired phrase, but we can get through this if we work together on a couple of things. Because none of us want this to be gone more than we do. And we really appreciate any help that you can give us. Thank you so much.